Now, South Africa is facing a critical moment in its fight against HIV/AIDS due to recent international funding cuts. Health Minister Aaron Motsoaledi is determined that the country will find other funding avenues and move away from reliance on international aid.
We believe it's high time that we become self-reliant as a country. We need to plan on that. But we didn't just sit and say we're waiting for that self-reliance. I've had lots and lots of meetings, including even yesterday, with other funding agencies around the world. But many of them, to be honest, they told us that we are going to try our best to help, but will not be able to replace the US in its totality. So the third thing we are doing because of that is to look at what is the part which you can take and at what level. We can't just say everything that was there is going to get replaced. No funder has been able to tell us that. Even funders that are governments, and they tell us straight that we are going to try and come in, but don't think we'll be replace anything. Now, the other fact you must remember, there is no funder or no government which had put money aside and say we are waiting for eventuality when something like this is done by Trump. Nobody foresaw, even though they knew his policies before he came in, but nobody saw this, this sudden, disruption of what's happening around the world, which has been happening over ages. So they have to sit back and think and see where do they start building up some resources in order to help, and that's going to happen. That includes Global Fund, which was established 2 decades ago to fight HIV, AIDS, TB, and malaria. Global Fund meets every 3 years to do what is called a replenishment round, put money together and see where they can help. Coincidentally, their next replenishment round is in September, and it's going to be in South Africa for the first time in 20 years. It has never been on the African continent. We're already having discussions with them, with the president of Global Fund and other stakeholders. Can we ramp up more than what we have done in other years because of this problem? So all those plans are in the pipeline.
Okay, so ENCA recently shared this saying that South Africa is facing a critical moment in its fight against HIV/AIDS due to recent international funding cuts. Health Minister Aaron Motsoaledi is determined that the country will find other funding avenues and move away from reliance on international aid. Hi. There is South African time. The name is Vidashi. Well, as you can see in the video, that is the South African Minister for Health, Mr. Aaron Motsoaledi, saying that the country actually needs funding to cater for HIV and AIDS, because after the US cut its funding to it, it's finding it hard time to actually deal with the situation here. Well, I know some past or some time ago, the South African government came telling us that the US funding to AIDS was actually around just 11%, and the country can actually take care of that, because South Africa was actually doing almost everything, or they own everything. Was in the US, the HIV project that the US was only supporting just 11% of it. But this is what the minister is now saying. Who are we to trust here? Who is wrong and who is right here? At the comment section, let me know what you think. Okay, this is what the minister is saying now. But about 2 months ago, they were saying something different here. I'm shocked. I'm surprised. Are you also surprised? Well, see this. So this one says they need condoms, not aid. Okay. Okay. This is funny. That's so true though. You guys need to protect yourself out there, okay? You need to protect yourself out there. You need condoms though. AIDS, you need the AIDS too, but you guys also need the condoms. You need to protect yourself. That's so true. Well, again, this one says you should have had plan B, but the begging bowl is the easiest. Oh, that's so true though. How can a sovereign country just be so much dependent on other countries for almost everything? South Africa should have had different ways or different revenue to cater for all these. Some South Africans were also saying that because of there's a lot of illegal immigrants on the list that are actually receiving free HIV treatments that they need to be cut off. That is the way so that the South Africans can be South first on that one also. So all these are some or other angles that they need to take into consideration and get things work done. Well, this one says a few weeks ago, they were saying the US only financed a small fraction of the program. Yet now they are scrambling to find funding. You can't believe a thing this pathological liar says. Well, as I was saying, the same thing this one is saying though. We all believed the last time that these guys made us believe that South Africa, the US was actually only supporting around just 11% of the whole HIV program functioning. But here we are crying about refunding or funding to this AIDS program. Who was telling the truth and who was lying here? Are you telling me that Trump has actually succeeded in these sanctions and making sure that the other countries feel the heat? What is happening in South African ministry, and why they always lie about some things? Why should they even lie about this? Well, again, this one says, easy. Start giving ARVs to illegal foreigners, put South African first. Again, this one also says that he stated that there was no issue with US stopping aid. Government could cover the cost. Now he has realized that there is no money for the caterers to eat. Nah. Okay, well, that's so true. Mr. Aaron, you actually did. There's a video of you saying that the South Africa can cater for the HIV/AIDS needs because of how the US funding was actually just 11%, or was just small in number. But now you guys are here saying something different. Are you trying to be so bold enough to let the South African people be strong to feel that you guys can be all right without the US? I know you guys can, but you need to have a different perspective or different funding. You need to have a plan B to it, okay? The HIV issue is so serious, it needs to be saved, and Africa needs to be working on, okay? Hopefully, Mr. Minister, things get better for you, and then everything works fine. You can also share your point of view at the comment section, and then we're so glad to talk about this. That is what your Minister of Health is saying concerning HIV/AIDS, and then the funding costs and the cost of funding. Thank you for your time.